Follow these steps to survive a heart attack when you're alone after 60. Every 40 seconds, someone in the United States suffers a heart attack. For seniors living alone, the actions taken in those first critical minutes determine survival. This is not about fear, this is about preparation. Today, you'll learn 7 evidence-based steps that could save your life if you experience a heart attack when no one else is around. Step number 5 is where most people make a fatal mistake, costing them precious time they cannot afford to lose. Pay close attention. Before we begin, drop your city and state in the comments below. Let us know where you're watching from. If you live alone or care for someone who does, subscribe to this channel. The information you're about to receive could prevent a tragedy. Senior Health Optimized exists to give you medical knowledge that protects your independence and your life. What you're about to learn is based on clinical guidelines from the American Heart Association and recommendations from cardiologists specializing in geriatric heart health. According to the Centers for Disease Control, adults over 60 face significantly elevated risk for myocardial infarction, commonly known as heart attack. Survival rates improve dramatically when immediate, appropriate action is taken. The difference between life and death often comes down to knowledge and decisive action in those first minutes. Here's exactly what you need to know. Step 1. Recognize the warning signs. The first step is recognition. A heart attack does not always announce itself with crushing chest pain and a dramatic collapse. In fact, according to Johns Hopkins Medicine, up to 40% of seniors experience what's called a silent heart attack. Symptoms are present, but they're subtle, easily dismissed, or mistaken for something else. Classic symptoms include pressure or tightness in the chest, often described as an elephant sitting on the sternum. This discomfort may radiate down the left arm, up into the jaw, between the shoulder blades, or into the neck. You may experience shortness of breath, even at rest. Cold sweats, nausea, sudden lightheadedness, or overwhelming fatigue can all signal cardiac distress. Here's what's critical to understand. Symptoms in women and older adults frequently differ from the textbook presentation. You might feel only mild discomfort, indigestion, or unusual fatigue. Some seniors report no chest pain at all, just profound weakness or difficulty breathing. Do not wait to see if symptoms improve. Do not dismiss them as indigestion or anxiety. If you suspect a heart attack, treat it as a heart attack. Your brain might tell you you're overreacting. Ignore that voice. Could kill you. Step 2. Call 911 immediately. The moment you recognize symptoms, call 911. Do not call a neighbor first. Do not try to reach your doctor's office. Do not wait to see if it passes. Call 911 first. Here's why this matters. Paramedics carry life-saving equipment and medications that can be administered en route to the hospital. They can begin treatment 30 to 60 minutes sooner than if you drive yourself or wait for someone to take you. Emergency rooms are notified in advance and prepare for your arrival, which means faster intervention once you're through the door. Time is muscle. Every minute of delayed treatment means more heart tissue dies. When you call, say this clearly: I think I'm having a heart attack. I am, state your age. I am alone. My address is, state your address. Stay on the line. The dispatcher may provide instructions while help is on the way. If you are physically able, unlock your front door after making the call. Paramedics need to reach you quickly, and you may not be able to open the door when they arrive. Many seniors hesitate because they worry about causing a scene, wasting emergency resources, or being embarrassed if it turns out to be nothing. Understand this. Emergency medical services exist for exactly this reason. Medical professionals would far rather respond to a false alarm than arrive too late. Better to be wrong and alive than right and dead. Step 3. Chew aspirin. After calling 911 and only after calling 911, take aspirin if you have it. Chew 1 regular strength aspirin, 325 milligrams, or 4 low-dose aspirin, 81 milligrams each. Chewing is essential. It allows the medication to enter your bloodstream faster than swallowing. Aspirin works by inhibiting platelets, the cells responsible for blood clot formation. During a heart attack, a clot typically blocks blood flow to part of the heart. Research demonstrates that aspirin, when taken during the early stages of a heart attack, can reduce myocardial damage by up to 50%. That's significant. However, do not take aspirin if you are allergic to it. If you are already on blood-thinning medications like warfarin, or if you have a history of bleeding disorders, aspirin could be dangerous. When in doubt, follow the dispatcher's instructions. Do not delay your 911 call to search for aspirin. The phone call is your priority. If aspirin is immediately available, take it. If not, don't waste critical seconds hunting through cabinets. Step 4. Sit down and stay calm. Once you've called for help and taken aspirin if appropriate, sit down in a comfortable position. A sturdy chair with back support is ideal. If no chair is available, sit on the floor with your back against a wall. Do not lie flat. Lying completely horizontal can make breathing more difficult if you're experiencing shortness of breath or fluid buildup. A semi-reclined or seated position keeps your airway open and reduces the work your heart has to do. Loosen any tight clothing, belts, collars, or restrictive waistbands. Your body needs to breathe without constriction. Now control your breathing. Panic is a natural response, but it is also dangerous. When you panic, your heart rate increases, your blood pressure rises, and your heart demands more oxygen. Oxygen it is already struggling to receive. Staying calm is not just psychological advice. It is physiological necessity. Count your breaths. Inhale slowly for 4 seconds. Exhale slowly for 4 seconds. This rhythm gives your mind a task and helps regulate your nervous system. Focus on the count. 4 in, 4 out. Repeat until help arrives. Step 5. Do not drive yourself to the hospital. This is step 5, the mistake that costs lives. Do not, under any circumstances, drive yourself to the hospital. Many people, particularly seniors who value independence, resist calling an ambulance. Ambulances are expensive. You don't want to cause a fuss. You believe you can make it to the emergency room on your own. These thoughts are dangerous. If you lose consciousness while driving, you will crash. You could die. You could kill someone else. Even if you remain conscious, driving increases your stress, elevates your heart rate, and delays professional medical intervention. Paramedics carry defibrillators, oxygen, and medications that can stabilize you before you reach the hospital. Your car does not. Furthermore, ambulances receive priority at emergency rooms. When paramedics call ahead, the hospital activates its cardiac response team. If you walk in through the front door, you join the queue. Minutes matter in a heart attack. Those minutes translate directly into heart muscle saved or lost. This is not the time to save money. This is not the time to worry about inconvenience. If you drive yourself and lose consciousness, no amount of money will bring you back. If you absolutely cannot access emergency services, if you are in a remote area with no ambulance coverage, have someone else drive you. Never drive yourself. This is non-negotiable. Step 6. Take nitroglycerin if prescribed. If your doctor has previously prescribed nitroglycerin for angina or chest pain, now is the time to use it. Nitroglycerin works by dilating blood vessels, improving blood flow to the heart. Place 1 tablet under your tongue and let it dissolve. If chest pain does not improve within 5 minutes, take a second dose. You can take up to 3 doses 5 minutes apart. Even if the nitroglycerin relieves your symptoms, do not cancel the ambulance. You still need to go to the hospital. Symptom relief does not mean the heart attack has resolved. Critically, only take nitroglycerin that has been prescribed to you by your doctor. Never use someone else's medication. Nitroglycerin can interact dangerously with other drugs, particularly medications for erectile dysfunction such as sildenafil, tadalafil, or vardenafil. The combination can cause a catastrophic drop in blood pressure. If you do not have a prescription for nitroglycerin, skip this step. Do not attempt to obtain it from a neighbor or family member. The risks outweigh any potential benefit. Step 7. Document what happened. If you are physically and mentally capable, write down what is happening. This may seem unnecessary in the moment, but documentation helps medical professionals treat you more effectively. Note the time your symptoms began. Write down what you were doing when they started. Were you exerting yourself, resting, eating? Record any medications you have taken, including the aspirin and nitroglycerin if applicable. List your current prescriptions and any known allergies. This information allows emergency room physicians to make faster, more informed decisions about your care. If you become unable to communicate, your notes provide critical data. A practical strategy: keep a small notepad next to your phone with your medication list, known medical conditions, and emergency contacts already written down. In an emergency, you simply add the current details. Better yet, store this information in your phone under an emergency contact labeled IC, in case of emergency. Place a medical ID card in your wallet with the same information. These small acts of preparation can shave minutes off your treatment time, and in cardiology, minutes equal muscle and muscle equals life. Let's reinforce what you've learned. 7 steps to survive a heart attack when you're alone after 60. Step 1. Recognize the warning signs. Chest pressure, radiating pain, shortness of breath, cold sweats, nausea. Symptoms may be subtle. Don't wait for certainty. Step 2. Call 911 immediately. Do not drive yourself. Do not call anyone else first. Call 911. Step 3. Chew aspirin if you have it and are not allergic. 325 milligrams or 481 milligram tablets. After calling 911, not before. Step 4. Sit down in a supported position. Stay calm. Breathe slowly. 4 seconds in, 4 seconds out. Step 5. Do not drive yourself to the hospital. Wait for the ambulance. Your life depends on it. Step 6. If prescribed, take nitroglycerin under your tongue. Up to 3 doses, 5 minutes apart. Still go to the hospital even if symptoms improve. Step 7. Write down what happened. Time, symptoms, medications. This helps doctors treat you faster. These 7 steps could save your life or the life of someone you love. Now it's your turn. Do you live alone? Have you experienced a heart attack scare? Share your story in the comments. Your experience may help someone else recognize symptoms or take action sooner. If this information was valuable, share this video with any senior in your life who lives alone. It could save them. Next week, we'll cover the warning signs your body gives you in the days and weeks before a heart attack. Subtle changes most people miss, but every senior should recognize. Subscribe now so you don't miss it. This is Senior Health Optimized. Knowledge is your best defense. Stay prepared. Stay safe.